So this is a case of a platelet-rich plasma injection / needle tenotomy in a roughly middle-aged man who likes to play softball, and his only real complaint was that he had difficulty throwing with his right arm. Otherwise, his function was normal, really not much pain during everyday activity. So MRI essentially showed a small tear of the distal supraspinatus tendon. We went ahead and did an ultrasound-guided needle tenotomy, platelet-rich plasma injection of this part of his rotator cuff, and the patient essentially got complete relief from this procedure, and he was able to return playing softball the way he wanted to. So this is a PRP injection for supraspinatus tendinosis and articular partial-sided supraspinatus tear. This is our patient's plasma just after we spun it. He is basically getting a right shoulder PRP injection for a distal supraspinatus tear, partial articular surface, and we're going to draw off some of this platelet poor plasma, and then we're going to mix up the PRP. Here we are, we're just drawing off some of the excess platelet poor plasma. So that we're going to discard. And on the right side you can see the MRI, which that small tear of the distal supraspinatus tendon. And here's his scan prior to the procedure. You can see the biceps tendon there coming into play, which is the anterior margin of the supraspinatus tendon. And here in this view, the supraspinatus tendon looks fairly well preserved. There is some subtle hypoechoic signal in the distal articular surface, in the distal articular side of the supraspinatus tendon. But this is pretty subtle finding, I believe. So this patient was actually sedated for this procedure, and he actually got a little bit wild during it. So I recommend not sedating patients. I don't think it's that unbearable where they can't do it without sedation. But here's basically our needle going into our supraspinatus tendon, and we can see the subdeltoid bursa as well above the supraspinatus tendon, and the overlying deltoid muscle as well. And there's our needle tip. It looks like it's actually within the tendon itself here. And we're starting to inject the PRP within the region where his articular surface tear is. And we're also doing a tenotomy / needle fenestration in that region as well to mechanically try to elicit healing. And then we're also injecting PRP within the subdeltoid bursa.